a mobile medical clinic. We offer harm reduction services for people struggling with addiction. We exchange safe injection equipment for people. We do HIV and hepatitis C testing. We treat people that are positive for HIV and hepatitis C, and we also address structural determinants of health. So we make sure they have clothes, we make sure they have something to drink, food, which all help. We make sure they have mental health counseling, all the things that help them manage to enter a successful recovery.
The number one thing is that we're just providing, we're meeting people where they are, and we're providing harm reduction in a setting that is most comfortable to them.
We're very fortunate to be able to partner with so many great organizations. Having the help of Pioneer Medical has been really important on the wound care side with their free clinic.
I do street outreach with the homeless. So I deal with people who are dealing with addiction and different things. And so I assist them, since they don't have a way to get here, I actually assist them with doing their exchanges and then take the supplies to them.
If you think about it, one case of HIV takes about $500,000 to treat. So $500,000 of treatment, medical care. So if there's anything that we can do to lessen that strain, that expense, that's what I'm here for.
So if you go back in time a little bit, when I trained, people who had opioid use disorder or using injectable drugs, they would come into the emergency department, and we really didn't have anything to do for those patients. We really didn't offer any type of treatment for opioid use disorder itself. We kind of gave people a brochure that said you could go to these different places out there, good luck. And what we know is that likely led to people who didn't make it, people who had mortality from injection drug use.
So this program means so much to me because these are patients that are incredibly vulnerable. They have numerous social, family, and economical barriers to being able to access care. And they get very, very sick, but don't have any way to get in touch with any healthcare providers. And so, for me, what's so important about it is the vulnerability, the loneliness, and the severity of the patients that we see here.
I have a place to bring my dirty syringes. I'm also a diabetic, so I take insulin. And sometimes I run out of my insulin syringes, and it really benefits. It helps people not use dirty needles. They are non-judgmental to everybody. They help you out. Anything you need, they help you with it. So, to their extent, anything they can help you with.
So the reason that I love coming to the needle exchange or having our staff come to the needle exchange is that I was a case manager for many years. And so I know that people who are intravenous drug users or who are homeless, they're some of the most vulnerable people, and they're taken advantage of many times and enrolled into programs that aren't the correct one for them, and they really creates more boundaries for them getting access to healthcare services. And so being able to come to the ID exchange and work with the incredible team here is something I'm super proud of.
I come here every week. They have helped me with insurance. They have helped me with, actually I had surgery, and they give me medical, like gauze and, anything I need they have given me. If it wasn't for them, I wouldn't know where I would get supplies that I need. These people are like family now because they know us by name. They treat me just like them. They would treat me like anybody else. They're really nice.
Emergency medicine is a field, a discipline that really tries to create a safety net for the community. And the idea of emergency medicine, people think of as just resuscitating heart attacks and big traumas. But really, if you get to the core of what we do in emergency medicine, is to try to fill the gaps in our community where there's not other care for people.
I want to make this a safe space where you're just a human being and you are valued and valuable, irrespective of whether you've been able to stop using drugs or not.
Silent night.
So today is our Christmas brunch. This is the second year we've done this, and all the staff make a dish homemade, and it's like a potluck, and we make sure that everyone has a Christmas meal. I think it's really important to make sure that everybody has something to eat at the holidays. We function like a family here, And so we want to make sure that our family is fed.
There was another holiday where they had a barbecue, and it's nice. I mean, any other time when you come in, they have snacks for you. They have, drinks if you need it.
This time of year can be very hard for people, especially people that are struggling financially, and so we did a toy drive to make sure from newborn all the way up to teenager that there was something that somebody could get for either their kids or their grandkids if they have them, or nieces or nephews.
We're just not here handing out supplies and education. We make it more personal. We really look at each person that comes here as part of kind of a family in a sense.
So far it's been great. Like, everyone has been awesome. I don't feel judged or anything like that. I feel like I'm just talking to a normal person who's helping me with supplies that I need. And it's also helping, like, they tested for HIV, they tested for Hep.
I would say the biggest thing I've seen so far is people letting me know that the Narcan I'm supplying them has saved multiple lives. I'd only been helping someone for probably 3 weeks when I got a text message that said, "The Narcan you gave me yesterday saved my life last night."
My side job I do with Ideal is that I've already been trained and stuff, and so I'm more of a elder-like from experience. I just put myself out there to assist and to help others know that we're here, and that I do my best to exchange what I can for those that are not able to get out here and stuff like that.
We've got some people who are completely clean, they're not using anymore, and they haven't been for years now, but they still come around, and now they bring their friends, they bring their family. And so they're kind of like our little ambassadors out there.
I'll ride a bike if I have to get here, but she drives me here right now. But if I have to ride a bike if I have to get here, it's awesome. These people are awesome.
The foundation of love and the care that they have to make sure that if you're doing what you're doing, doggone it, we're gonna make sure you're gonna be all right while you're doing it.